Imagine that you're having a nice lunch at a beachside restaurant. You look over at the table next to you and you think how good the food on the woman's plate looks. She's having a giant lobster, having a great time with her family, and then all of a sudden she takes a couple bites. And then you see red blotches, some redness in her face, some swelling. She starts gasping for air, and then she falls on the floor. Hi, I'm Allison Turner. Today I'm going to talk to you a little bit about anaphylaxis. Anaphylaxis is basically just an exaggerated allergic reaction to something. I'm going to talk a little bit about some things that can cause it. I'm going to go over some signs and symptoms that you might see if someone has a reaction like that, and also some treatment options that follow. So let's take you back to that restaurant. She was eating a lobster. Lobster is shellfish. A lot of people are allergic to shellfish. So if you ever hear someone say that, they probably have shrimp allergies, crab allergies, lobster, the whole gamut, unfortunately for them, because that stuff is really good to eat. Another thing that can cause an anaphylactic reaction is a stinging insect. If you ever get stung by a bee, wasp, hornet, any of the above, you may end up having an anaphylactic reaction, which is very unpleasant. Some 40 Americans per year die due to anaphylaxis. Another thing that can cause them are other foods, such as eggs, nuts, peanuts. There's a whole gamut. Fruits, I've seen all kinds of things people have been allergic to. And latex is also a very, it's a large population that's allergic to latex, like 1% of the United States. However, in the grand scheme of things, that doesn't seem like too much. So a lot of medical facilities have latex-free carts available for people who are allergic to things, so that way they don't touch latex at any time. And lastly, something strange that can happen is an exercise-induced anaphylactic reaction. This happens with people who are allergic to some fruits and things, but also it can just be an idiopathic type thing where it's unknown. The cause is very unknown. So if you're ever out and about and you see someone eat something, start to swell, or get stung by a bee, any of those things, some signs and symptoms to look for include, like I talked about before, the hives. Hives appear in red splotches that can be raised all over the body. They're very itchy. Some people's mouths swell. Some people swell all over. Another thing that can happen is respiratory issues. People gasp for air because their airway is swelling shut. Another thing is gastrointestinal problems. Some people will have diarrhea, vomiting. They will lose control of their bowels at some point. And some weird things that can happen are seizures, and also people will just flat pass out, like I talked about in the restaurant. That doesn't usually happen, but it can. So if you see these things and you want to know what to do to help someone, the biggest and most effective thing you can do is give them epinephrine. Now, most people, I know I don't, a lot of people don't carry it around on their person, but the person that had the reaction might actually have an EpiPen. Epinephrine is a drug that actually constricts your blood vessels, thus making your heart rate increase, and it also dilates your airway, your air passages, your bronchioles. So that way, if your airway is swollen from a food or a stinging insect, then giving this medication will actually open it up so people can actually start to breathe. So this is what an EpiPen looks like. This is a standard training tool that we give our patients who are newly prescribed an EpiPen. So the first step you need to do is take off the blue cap. Always take the blue cap off first. If you go with the bottom, you're going to get hit with a needle, which will be very painful. It can actually go through your finger, and it can have some serious side effects if you're actually hit with epinephrine yourself. So if you see the person and they're unable to give this to themselves, what you're going to do is expose their thigh. I know it sounds a little uncomfortable, but you're thinking about, hey, I'm saving this person's life. So what you're going to do is you're going to hit them in the thigh with this and leave it there for 10 seconds. The needle will come out, the epinephrine dose will come out, and then it goes as an intramuscular injection. That is the most important step you can have with anyone having an anaphylactic reaction. The second thing to give is oxygen. This usually happens after the paramedics show up. So an oxygen tank, an oxygen mask will help. Since you're already opening up that airway again, you need to put some 100% or as close to 100% oxygen into those lungs to get them working again. Another thing that you've probably heard of are antihistamines. Histamines are actually chemicals in your body that create allergies and allergic reactions. So Benadryl is a fantastic histamine to use. And I know most of you have probably taken Benadryl for one reason or another, whether you can't fall asleep or you got stung by a bee or something like that. So I hope you've learned a little bit about anaphylaxis, kind of what it is, some things that can cause it, some signs and symptoms, and some treatment options. So I appreciate your time and thank you for listening.